Hello, it's Dr. Adi again. And now on our last short on endometriosis. So we've made a diagnosis. We've had a laparoscopy. We've had a look. Say we've got some endometriotic spots. We've got some scarring. We've got some chocolate cyst. We've made a diagnosis of endometriosis. What then? Now, remember we said we've got pain. We've got possible infertility, we've got heavy periods. So we're going to look at these symptoms and we're going to try and treat one by one. So looking at the endometriosis itself, it's not a condition that can be cured. Bear in mind, I've been saying treat. We can treat it, but it's not a condition that can be cured. Now, if what we tend to aim to do is to look at these symptoms and we tend to want to reverse them. So painkillers comes in number one. So anti-inflammatories are very useful because the main problem with endometriosis is causes an inflammation, usually a chronic inflammation. So if we use anti-inflammatories safely, obviously, is very useful. Now, we discussed the use of laparoscopy to treat. So like we said, it's going to release adhesion. So it's going to treat all those stuck together bits. It's going to treat any chocolate cyst. It's going to burn any endometriotic spots with what we call diathermy. And all these things help to treat it, and it actually improves your chances of conception once it's treated. So that's one. Now, there's some medical treatments we can use. You can imagine what we said. We said a retrograde bleed can cause it. So the treatments, if we follow that, and we're not looking at somebody who's trying to conceive, is to try and stop that bleed. So to try and stop periods or reduce periods. So we use things like the Mirena, which is an intrauterine device. We place it in the womb. It's progesterone, and it thins the lining of the woman, hence stops bleeding, or at least reduces it significantly. Now, the other things we can use is what we call the oral contraceptive pill. You'd have heard of that before. Sometimes we use it continuously, and it can reduce or even stop your periods. And the same with progesterone. Use it continuously and it can stop your periods. In the olden days, we used to use things like danazol. Not used very often anymore. I suspect it's because of the side effects. It gives male kind of hormone side effects because it's similar to the male hormone. But it's very effective in that it stops bleeding, but it gives side effects of giving you hair where you don't want, weight gain, even voice change, hair loss. So you can imagine that hair loss on the head and hair where you don't want on the body. So those are essentially the treatments of endometriosis. I hope you find that useful. Thank you very much. Bye-bye.